Okay. Can you see the PowerPoint or not? I think it's not. Can you see it?
Mr.
Uh,
I have a question about OSCE midterm exam.
mhm.
Each student will do three procedure or only one procedure.
No. If the procedure in the exam is 3, that means you're going to do 3 procedures. And you're going to repeat. Any more question? Any more question before I... Okay, no? Can you see the PowerPoint whole or it is half?
Half.
It's whole, it's not half? How about other students? Can you see the PowerPoint clearly?
It's half.
Yeah, I can see also half. I don't know why this is half. Wait. I'll try again. Okay. Okay, wait, I'm fixing it. Be patient. I'm using 2 computers now because I want to see how my students are doing. Okay, how about it? Is it complete?
Yes.
Okay, thank you so much. Okay, so this afternoon we're going to have our last topic for the midterm exam, and this topic is included in the midterm exam itself. Okay, and before we start our discussion, I want you to answer this question. Okay, the question is very simple, and I want you to use again your cell phones if you have your cell phones there, just like what we did previously. Now the question is very easy, and the question says, how do you know if a person is sick? Okay, based on your personal experience, when you see a person, how do you know if a person is sick? Okay, you can type in your responses using your cell phones, and I'm interested to know your responses. Again, ask yourself, if you see a person, how do you know if a person is sick? Okay, I can see answer like emotional and physical changes. So that's how you diagnose if a person is sick. Some says based on her facial expression. Oh, based on facial expression, perhaps if the person is crying, that means that person is experiencing something. Okay, from his face and voice. Mhm. From his appearance. Some says, I know if person is sick through his appearance. Some says when he described it to me. Okay, when the person reports that I am sick, then that's the time you can say that the person is sick. Some says symptoms appear in his body like sweating. So that means you can see some physiological changes. It's very observable when you see a person. Okay, his or her face or body. Through diagnosis. Okay, all answers are valid, but I'm going to ask the student who answered from testing. Who answered this answer from testing? You can open your audio and you can share it to us. Who answers from testing? Don't worry, there's no right and wrong answer. We just need your opinion. I want the students who answered from testing. Hello? Come on. Again, the question is, how do you know if a person is sick? Okay. Okay, his appearance, person's behaviors, physical examination, it's a good answer by examining the person, checking the physical aspects. If the person says, I am sick. Okay, thank you so much for all your answers. Now, before I go for the discussion, some students are saying that the sound is not clear for me. Is my voice, my audio clear or not? Could someone answer me? Is this audio is clear?
Yes, it's clear.
Clear.
Okay, thank you so much. Okay, now let's go back to the discussion. I can see valid answers from the questions which I have posed. How do you know if a person is sick? And a lot of you answered through the appearance, some physiological changes, through examination, when a person says that he is sick, by checking the vital signs. All those answers are valid. First, if the person is sick, you can see some obvious changes on the physical aspect of the person. However, not all illnesses and diseases can be evident on the physical aspect of a person. You might think that the person looks sick, but in fact, he is not. Okay, check for vital signs. Yes, it is possible also. If there are problems of the vital signs, a person could be sick. However, it is not definitive. Some answered here, when the person says, I am sick, or when a person reports that I am sick. Again, it's a valid answer. However, there are some manipulative patients who might not tell you.
Your audio is not clear.
Are you sure? Your audio is not clear. Okay, before I continue, I want you to write in your chat box, my audio is clear or not? Clear. Okay, it's clear. Okay? Most of the answers are clear. That means the problem of the audio is not my audio, but your audio. Please fix your audio because all students are saying that the not clear, Shaika, but the rest are clear. Maybe you can end the media. I mean, you can log out and then enter again, because it's only one or two persons saying that the audio is not clear, but most of the students are saying that the audio is clear. Okay. Anyway, let's go back to our discussion. Okay. Now, how do you know if a person is really sick? And I can see an answer list that says lab test. Okay, this is a very good answer. Okay, even if a person looks sick, or even if a person says he is sick, again, we cannot conclude that that person is really sick. And when a patient is admitted to the hospital, doctors, before they can diagnose, before they give treatment, or before they give medications to some patients, they need to be sure that the person is really sick. And one of the best way of knowing it is through laboratory testing. Okay? Testing some blood, doing some x-rays, or any other laboratory testing. Again, laboratory testing or diagnostic testing is very important, especially in the hospital, because it guides doctor in determining whether the person is really sick or not. That's why our topic this afternoon is about diagnostic testing. In particular, our learning objectives for this class is first, to describe the purpose of laboratory testing. We're going to discuss why these testing are done to the patient. What are the importance of this testing? Why it is done to your patient? The second one is identify the roles of a nurse in diagnostic testing. Okay, if your patient is scheduled for some testing, what will you do as a nurse? What is your obligation? What is your responsibility as a nurse? And we need to discuss all those things. And the third one, which is very, very important, is to identify the different types of laboratory and diagnostic testing. Why you need to learn the different types of laboratory and diagnostic testing? When you work in the hospital, you will be confronted with a lot of tests, several diagnostic testing. And as a nurse, you need to learn each and every testing and what is your responsibility if the patient will undergo this type of testing. Okay? Now, to move on, diagnostic and laboratory tests are very important, as I mentioned earlier, because it provides information about the hematological system. When we say hematological system, I am referring to blood or circulatory system or the blood itself and many other body systems of the client. The results of these tests, commonly it is called lab tests. Okay, the results of these lab tests will guide the doctor, okay, in diagnosing, in identifying the problem of the patient. The results of these tests will tell the doctor, hey, the patient has this problem. That is how important diagnostic and laboratory tests are. And normally, in the hospital, diagnostics and laboratory tests are routinely done. When we say routinely done, the moment the patient is admitted into the hospital, these tests are routinely given. Okay? Which means all patients should undergo these tests. Okay, when we move on to the following slides, I'm going to tell you what are the routine tests being done to the patients and what are the special tests performed to our patient. Okay, now, before we move on with the different roles of nursing, I want you to identify the two basic types of diagnostic tests. Okay. Diagnostic tests could either be non-invasive or invasive. And the difference between the two is very obvious. When we say non-invasive, from the word itself, none. Okay, none. Non-invasive means the body or the body of the patient is not entered with any type of instrument. So technically, these non-invasive procedures poses no risks. It is safe for your patients. Why? No instruments are inserted into the body system of your patient. I want you to look at the photo in the slide right now. Okay? This photo, the nurse is checking the urine. It is non-invasive. Why? Because you just need to ask for the urine of the patient, and with the urine of the patient, you need to check what's the problem with the urine. It is non-invasive. Why? You did not prick the patient with a needle. You did not insert any instrument to the patient. That's why it's called non-invasive. The second type of diagnostic testing is the opposite of non-invasive, and it is invasive. Okay, invasive procedures are procedures where the body's tissues, organs, or cavities are accessed through some type of procedure making use of instruments. Now, I want you to look at the photo below. Okay, it's a man sitting on the cardiac table, and a needle is inserted into the side of the lungs. Is it invasive? Yes. Why? You are introducing a needle. You are introducing some instrument and you penetrate the organ or the tissue of the body. Therefore, it poses some risks to the patient. Therefore, the diagnostic test is considered invasive. Okay, now, what is the responsibility of the nurse if the procedure is invasive? As I mentioned earlier, non-invasive procedures generally are safe. However, for invasive procedures, because the body system is accessed with some instruments, and there is a risk for their safety. Therefore, you need to ask for patients' informed consent. Mister, what is this informed consent? Informed consent is permission granted by the patient. Before you perform invasive procedure to the patient or invasive diagnostic test to your patient, you need to ask for the informed consent. You need to ask for the signature of the patient. Why you need to ask that? Because the procedure has a risk to the patient. Unlike invasive procedure, no consent is needed. Do you see the difference between the two? Okay, now, this is very important. And I know a lot of you are asking, why laboratory tests are done? Why diagnostic tests are performed when a patient is admitted to the hospital? Okay. The first one is to detect and quantify the risk of future disease. You know, because of some advancement in the technology, through laboratory testing, doctors can identify already if the person has the risk of developing disease in the future. That is how advanced our technology. It can predict already. Through tests, I can identify whether this person has the risk of cancer in the future. That's for number one. Number two is to establish or exclude diagnosis. What do we mean by establish or exclude? When the patient is admitted into the hospital and the patients complain of abdominal pain, the doctor cannot identify exactly yet what is the problem. Perhaps it is the large intestine that is aching, or maybe it's the appendix, or maybe it is the stomach, or maybe it is the kidney. Why? Because in the abdomen, there are a lot of organs. So how does laboratory test help? It excludes diagnosis. It identifies exactly what is the cause of the disease. Now, if the doctor is suspecting 5 different problems of the patient, since laboratory tests are done, the doctor can actually exclude the 4 and identify what is the relevant diagnosis of the patient. That is why laboratory testing is done. Number 3 is to assess the severity of the disease process. See, severity. Is it mild, or is the problem or is the disease already in the advanced stage? Or is it not severe? Or it is just a mild problem? Through laboratory testing, you can actually identify the severity of the disease. Now, this one is very important to guide selection of intervention. What I'm trying to see here is that when the patient is admitted into the hospital and the patient's complained of something, for example, abdominal pain, the doctor cannot right away provide treatment to the patient. Why? Because the doctor doesn't know exactly what's the cause. But because of the laboratory test, the doctor is sure that the problem originates from the stomach or kidney or appendix. Therefore, the doctor can choose or select the best treatment or the best interventions for the patients. That is how important diagnostic and laboratory tests are. Next is to monitor the progress of the disorder. Okay, as I mentioned earlier, if laboratory test is done, you will actually know, for example, if the cancer is in the first stage, or if it is in the advanced stage, or if it is in the terminal stage. Through testing, you can identify those things. And most importantly, the last, laboratory or diagnostic testing are done to monitor effectiveness of the treatment. Okay. Normally, before the patient is discharged from the hospital or before the patient is sent back home by the doctor will require first laboratory tests. And through laboratory tests, if the doctor can see some improvement in the tests, that means that the treatment is effective. Okay, these are the purposes, these are the indications why diagnostic testing, why laboratory testing are done. Okay, just before I proceed with the next topic, any questions with regards to the purpose or indications of laboratory testing? Or my question is this: do you have any experience wherein um, for laboratory testing? Do I have student here who undergone blood test or mouth swab or testing of the urine? Do I have student here? You can open your audio. Hello? Okay. How about, do we have student here who experience swab for testing for, like for example, any virus, if you had that experience? Do I have a student here who had swab test before? Or blood tests? Or x-ray? Hello, answer me. Okay, can you type? Okay, who is this?
Yeah, I have a blood test.
Okay, do you have experience, Tahani, of any testing performed to you?
Yes, a blood test.
Okay, why did you have a blood test?
I have blood deficiency, iron deficiency.
You had what again?
Blood deficiency.
Because you are experiencing something wrong, that's why a lab test was performed to you. Sa?
I have a problem in the level of iron in my blood.
The level of?
Iron.
Okay.
I think it's like
Okay, it seems that I could not clearly hear what he's saying. Level of, can you encode it? Level of what? Can you encode it in the chat box? Okay.
iron.
Iron, very good. See? Tahani says a blood test was performed to her in order to check for the level of iron. Perhaps the doctor is suspecting that Tahani has low iron supplement in the body. Maybe Tahani is experiencing some dizziness, or maybe the color of Tahani is pale because of deficiency in iron. That's why the doctor performed lab tests. In the case of Tahani, measuring of iron in the blood was used, I presume it was used to establish or exclude diagnosis. The doctor wants to know, okay, the doctor wants to identify the level so that, the level of iron, so that the doctor, okay, is guided whether to give supplement, iron supplement to Tahani or not. So what was the result, Tahani, of your iron testing in your blood? Tahani, what was the result? Can you share?
Then I have an deficiency or low level of iron.
So there was a deficiency in iron. The doctor was able to establish the diagnosis, iron deficiency. So what was the treatment provided?
I get some pills that provide that iron level in my blood.
Were you given medication, iron supplement?
Yes.
Okay, very good. See, because of the test, because of the blood test, because the doctor identifies that Tahani has low level of iron in the blood, the doctor was guided by the test, and the doctor was able to give proper treatment to Tahani. Now, do you appreciate now the importance of laboratory testing? This is exactly the reason why testing is very important. Thank you, Tahani.
Thanks.
Okay, any questions with regards to indications, with regard to purposes? I hope it is clear to you. Now, laboratory testing or diagnostic testing for ordinary people, it can actually create anxiety. Why? Especially for those individual who doesn't have medical background. The moment they hear test, laboratory test, diagnostic test, normally they would be anxious, they will be afraid, they will be fearful. There would be a lot of stress. Why? Because you do not know exactly what's going to be done with you. So what is the role of a nurse now? Okay, at this point, when your patient is scheduled for laboratory testing or diagnostic testing, whether it is invasive or non-invasive, you need to prepare your patient well. Okay, so how do you prepare your patient? First, evaluate the client's anxiety level, especially for for patients who are admitted for the first time. Expect the anxiety is high. Okay, once the anxiety is high, what do you do next? Teach relaxation technique. Make sure that your patient's anxiety level is reduced by teaching relaxation technique. Okay, you check also for the safety of the patient. You check also for the comfort of your patient. That is very important if your patient is scheduled for testing. Okay, now, these are the specific role of a nurse in diagnostic testing. When you work in the hospital, these are the expected things that you need to perform as a nurse. First is to facilitate scheduling of the test. This is very important. You need to call the laboratory. I'm going to schedule my patient at which time, okay, at which day. The second one, perform client teachings. You need to give health education to your patient. Okay. Third is perform or assist in the procedures. There are some instances wherein you need to be with the patient. Okay. You need to comfort the patient. And you need to be knowledgeable about the procedure. Next is to assess client for adverse responses to the procedures. Now, when we say adverse responses, I'm talking about invasive procedures, especially if something is being introduced to the patient. Some patients might develop adverse effect, and you need to assess for that. Okay. Next, preparing the procedure room. If the procedure is to be performed in the patient's room, you make sure that the environment is well lighted. What else? Gathering and charging for supplies to be used. That is very important. What are the things needed? Swab, needles, and other things. Okay. Number 7 is testing the equipment to ensure if it is functional. You need to check the materials to be used. Make sure that they are not defective. Make sure that they are functional and useful. And the last but not the least, secure proper containers. Containers means, small material to put the specimen. What is this specimen? I'm going to talk on the next few slides. What is a specimen with regards to diagnostic testing? Okay, now this is very important. When I say diagnostic and laboratory testing, there are several types of tests that you will encounter. And the most common tests performed in the hospital is the blood test. I know some of you have already undergo blood test, okay? This procedure is invasive. Why? Because a needle is injected to the patient and a small amount of blood is withdrawn from the patient itself. So blood test, okay? It involves blood collection. The second one is specimen testing. By the way, I'm going to discuss this in details. The second one is specimen testing, examination of specimen such as the urine, the stool, the blood, and the wound. Mr., why urine? Why stool? Okay. Well, aside from blood, if a patient has certain conditions or problems, okay, it is also observable in the patient's urine and stool. I'm going to discuss that in details. The third types of test is visualization procedure. This procedure is invasive. Why? visualization procedure from the word itself, visualize, with the use of instruments inserted into the body of the patient in order to visualize certain organs or body parts with the use of visualization instruments. Just look at the photo below. See? A tube is inserted into the mouth of the patient. Okay? On the tip of the instrument is a small camera, a small video camera, in order to visualize the gastrointestinal system, the respiratory tract, anything inside the body. Okay, the fourth type of test is aspiration. Aspiration, okay, or withdrawal of fluid that has abnormally collected. Okay, now, there are certain parts of our body wherein fluid might accumulate. For example, in your knees or in the joints, the patient has arthritis, you might expect some fluid accumulation there, and the doctor might aspirate, might withdraw fluid from that part of the body, and the procedure is called aspiration. And then the fluid collected through the process is examined for possible diseases. And the last is biopsy. I know some of you have already heard biopsy, okay? Especially if the patient is being suspected of having cancer. For example, a patient might have breast cancer. The doctor might say, okay, we will remove a small tissue from the breast, and then we're going to examine if this tissue or if the breast has cancer or not. And these tests is called biopsy. Okay, any questions with regards to the different types of the tests? Please type in no, or please type in the question if you have questions. These are the basic tests that we perform in the hospital, and I'm going to discuss each and every tests in the next slide. Thank you so much. Okay, now, I have a question here, and let us see if you are able to answer it with the use of your cell phone. The question is true or false. Examination of the feces or stool, you know already what is feces or stool, is an invasive procedure. Is it true or false? I'm going to count 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. I need an answer from one student. I'm going to call in the student whose name is appearing on my screen. Yusuf. Yusuf, please open your audio. Yusuf.
Yes, doctor.
Okay. Examination of the feces or stool is an invasive procedure. True or false?
It's false.
Why it is false?
Because invasive procedures are regarding the body tissue, organs, and the cavities
Mhm. So,
with the use of instruments.
so when we examine the feces and stool, are we inserting or are we introducing instruments to the patient's body?
We're not introducing any instruments to the body, but we are using instruments to collect the feces, I think.
Okay, thank you so much. Yes, very good. Okay, the answer of Yusuf is very clear. It is an invasive false. Why? Because when you check, you just ask the patient to collect the feces and stool. You do not introduce something to your patient. You do not introduce tube to the patient. You do not introduce needle to the patient. Therefore, examination of the feces is a non-invasive procedure. So the answer here is false. It is not invasive. It is non-invasive. Some are still answering, but your answer is wrong. Okay, another question. In the exam, questions might be like this. Which of the following tests involves removal and examination of the tissue? A, biopsy. B, visualization procedure. C, aspiration. I will count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I'm going to call one student to explain her answer, and I'm going to call Suha Al-Abri.
The answer is biopsy.
Okay, why is not aspiration?
Aspiration, we remove a fluid from the body, not a tissue.
Very good. Why it is not visualization?
Not, not visualization.
Maaraf. Okay, very good. Your answer is correct because we are taking a sample of a tissue. It is called biopsy. It is not aspiration because aspiration is you withdraw some fluid. It is not visualization because you are not introducing any instrument to visualize the organs and tissue of the patient. Thank you so much, Miss Soha. Okay, here we are. Okay, I have a question here from Shaika. I have a question regarding type of diagnostic test. Is blood tests, okay, considered as a part of specimen test? If yes, why it takes another example? Okay, let's go back to our discussion here. Okay, it's a very good question. Blood test itself is a form of specimen. You are correct. Blood itself is a specimen. The reason why we divided the different type of the test into this category because the blood test itself is composed of several tests. But you are correct. Blood itself is a specimen. We consider that as a specimen also. But the blood test itself is composed of several tests. Okay? You are correct. That's a good observation. That means Ms. Shaika is really engaged in our discussion and is reading our PowerPoint well. Thank you so much, Ms. Shaika. Okay, let us first discuss one of the most common tests performed in the hospital. Almost all patients admitted into the hospital are being subjected for blood tests. Almost all patients, once they are admitted, right away the doctor will say, I need a blood test for this patient. You will not be exempted. Almost all patients will go blood test. And blood test is simply a collection of blood samples for the examination. And the process of taking a blood from your patient is called venipuncture. Okay, it is a process. And normally the person who collects the blood from the patient, they are trained. You cannot just take the blood sample from your patient if you do not have the training. We call them as phlebotomists. However, when you work as a nurse, when you will become a nurse after 3 or 4 years, you will undergo certain training. You can actually be a phlebotomist also, but you need some training. Now, I want you to look at the PowerPoint right now, and you will see that the blood tests has different indications. We have at least 4 classifications of blood tests, okay? And we have the complete blood count, we have the serum electrolytes, we have the serum osmolality, we have drug monitoring, we check the blood for arterial blood gases, for blood chemistry, for metabolic screening, and for blood glucose. And I'm going to discuss one by one. Okay, here we are. This is the most common test performed to your patient, and we call it as CBC, or complete blood count. From the word itself, complete blood count, remember, your blood has a lot of cells. You have red blood cells, you have white blood cells, you have platelet count. And from the word itself, complete blood count, when we see complete blood count, I need all the results. I need the results for RBC, I want to know the WBC, and I want to know the platelet count. Okay, now, why is it important to check for the blood count? Well, normally, if a person is sick or if the person has a disease, usually the RBC, the WBC, and the platelet count are affected. I will give you an example. If the patient is having some bleeding, normally the red blood cells is reduced. Or if the patient has some infection, normally the white blood cells are increased. See how important. Now, Mister, why do we need to learn the different normal values for blood count for a patient? Just try to look at the slides. The red blood cells for men is 4.6 to 6 millimeter cubic millimeter, while women has 4 to 5 cubic millimeter. Now, why do you need to learn the normal values? Mister, why do I need to memorize what is the normal RBC for men and what is the normal RBC for women? Because if you do not know the normal value, if you do not know which one is abnormal or not, how will you help the patient? How can you provide nursing intervention to your patient if you do not know the normal values? Okay, for hemoglobin, we have the normal values of 13.5 to 18 for men, and we have 12 to 15 for women. Hemoglobin is the iron portion of the blood that carries oxygen. We also have hematocrit for men, 40 to 54%. For women, 36 to 46%. I have a question. If you can observe, the red blood cells, the hemoglobin, and hematocrit, the value for men is higher than women. What do you think is the reason? Anyone can answer. Observe, the red blood cells, the hemoglobin, the hematocrit, women has higher value than women. What do you think is the reason? I need an answer from female student, and I want to call Muna Alfazari. Muna?
Hello, Mister.
Do you have any idea? What do you think is the reason why the red blood count of male is higher than female?
Maybe because of effect of some hormones.
Some hormones, most possibly. Thank you, Muna. I want another answer from Buthaina Al-Abri.
Yes, Mister.
What do you think is the reason why women has lower blood count than male?
I think maybe it's because of their body size.
Body size. Thank you, Buthaina. I will call one more student. Esra Al-Dubhaishi. That was a good try. Esra? Esra? Okay. Diana. This time I'm going to call Diana. Diana? Okay, anyone who know the answer can open. Okay, Diana is here.
Yes, Mister.
Okay. Again, my question is, if you want to see the result, it seems that men have a higher blood count level, red blood count level than women. What do you think is the reason? Your other classmate says some hormones, one of your classmates says body size. What do you think is the answer?
I don't know the specific answer, but I think it's the hormones.
Okay, thank you, Diana. Okay, the best answer here is that women has menstruation. You know menstruation, I need not to explain it. Menstruation, it's a monthly period, and women are losing blood every month. That's the reason why women has low level of red blood count than male. Okay? Now, aside from red blood cells, we also check for the white blood cells. The white blood cells are very important because it fights the soldier of the body. And once the white blood cells is greater than 11,000, that means the patient is having infection. Okay, platelet count is very important because it is responsible for coagulation. That means if the patient is bleeding, if the blood count is normal, it will help stop the bleeding of your patient. If the platelet count is below 150,000, the patient is prone to bleeding. That is how important for you to know what is the normal values of the blood count. Okay, I want you to see the photo on the other side. See, the person is taking blood samples from the patient. But this picture, the nurse is unsafe. Do you know the reason why the nurse is unsafe while taking the blood of the patient? You can type in your answer in the chat box. Why do you think this picture is unsafe?
Maybe the patient blood can enter to the nurse. Maybe he had a severe disease like HVI or something.
So what should the nurse do?
Wear gloves.
Very good. Okay, wear gloves. The nurse here is unsafe because he is not wearing gloves. Whether the patient is not sick or sick, the moment a blood test is ordered, you consider the patient as infected, you need to protect yourself, you need to wear gloves. Very good observation. Okay, that is the first test. Blood count. RBC, WBC, blood count. Now, a blood test is also performed to a patient in order to check for electrolytes. Are you familiar with electrolytes? I think in anatomy it was discussed already to you. Electrolytes are very important in our body because it is responsible for maintaining body processes and fluid balance. We have sodium, we have chloride, we have calcium, we have potassium, we have phosphate, and we have magnesium. We call them as electrolytes. Are they important in our system? Yes. For example, serum and chloride, sodium and chloride. Okay. They're very important. Why? They are helpful in maintaining fluid balance. That's why if a person has abnormal level of sodium and chloride in the body, the patients might have problems with fluid balance. See the purpose of calcium, muscle contraction, and nerve function. That's why if the patient has low calcium, okay, calcium electrolyte, what will happen? There might be some muscular contraction. Okay? Phosphate is very important because it's for energy storage. Potassium is very, very important also because it is for heart contraction. Magnesium is for heart function and nerve function as well. Now, if your patient is subjected for this test, what is your role? What is your responsibility? Make sure you know what is the normal values. Make sure you know if it is high. Make sure you know if it is low. Why? Because if the electrolytes are low or high, the patients might develop some problems. And as a nurse, it's your responsibility to know and to identify. Is the sodium normal? Is the sodium abnormal? Or which of these electrolytes are normal or not? And once you have identified abnormal sodium or any electrolytes, you need to report it to the doctor right away. Why? Because some conditions might be very fatal. It might cause death to your patient. On the slide right now, you would see the normal values, 135 to 145 for sodium, 4.5 to 5.5 for calcium, 1.8 to 2.6 for phosphate, and etc. Make sure you know the normal values. Okay, let us see. I know you did not memorize the numbers. Which of the following electrolyte results is alarming? Which means which of the following electrolyte results is abnormal. Let us see if you can memorize the previous slide. Okay, I can see answer like potassium. I will count 10. 1, 2, 3, 4. I can see answers like sodium. 5, 6, 7, 8, 9, 10. Okay, most of the answer says potassium, 3.5 to 6.5. It is alarming. Why? Because, according to your answer, it is abnormal. Let's go back to the previous slides. What is the normal level of potassium? Potassium is 3.5 to 4.5. And your answer here is 3.5 to 6.5. That means 6.5, that is higher. And once the electrolyte level is lower than the normal or higher than the normal, it is a problem. That's why you need to know how to identify whether the level is abnormal or not. Okay, another question. Which of the following CBC result is within the normal level? RBC count of 4.6 to 8 cubic millimeter, hemoglobin of 13.5 to 28 gram per deciliter, WBC count of 4,500 to 21,000 cubic millimeter, D, platelet count of 150,000 to 350,000 cubic millimeter. I'm going to count 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Most of the answers says platelet. All of the answers says platelet. 150,000 to 350,000. Let us see. Platelet count 150,000 to 350,000. It's normal. So 95% are wrong. What is the correct answer? The correct answer is, yes, you are correct. Normal level. The rest, they are abnormal values. Okay, you expect some questions similar to that when we go to your midterm exam next week. Okay, I think we still have time. I'll just discuss this one. We're done with the CBC or complete blood count. We also perform blood tests to check for electrolytes. Now, there are other tests that are also performed using the blood of your patient. The other one is called serum osmolality. Okay? And this test is very important because it exactly measures some solute. I think in your chemistry, you discussed already what are solutes. Okay, solutes that are present in the blood. And this solute, okay, are very important because it is responsible for fluid balance. Now, what are the common solutes that we have in our blood? Sodium ions, glucose, urea. Those are the common solutes okay, present in your blood. Now, normally, we have solutes in our body at a level of 280 to 300 milliosmol per kilogram. However, if the level of solute or the osmolality is greater than 300, the patients might have problem with fluid volume deficit. Fluid volume deficit means the amount of fluid in the body is abnormally low. If the serum osmolality is lower than 280 milliosmol per kilogram, the condition is called fluid volume excess. When we say fluid volume excess, the fluid in the body is abnormally high. Why? Because these solutes again are responsible for fluid balance. Okay? This is the purpose of this test. And we call it as serum osmolality. Now, we also perform blood tests for drug monitoring. I think you can see in the slide right now. for drug monitoring. I do not know if you can still remember when we discuss medications. We says that medication should be within the therapeutic level, should be maintained in the blood. Now, doctors wanted to know also the level of medications or drugs in our body. Okay, doctors wanted to know if the level of these drugs are within therapeutic level, or maybe the drug is very high in our blood, or maybe the medication is already very low in our serum. Normally, a blood test is performed. Specifically, there are two things that you need to remember when it comes to drug monitoring. The first one is peak level, means the concentration or the level of the medication in the blood is very high. Normally, after 1 hour of taking the medication or the drugs in your blood is at the peak level. See? Also, the other term is called TRO level. TRO level means when the blood is checked and the level of the medication in the blood is very, very low. We call it as true level. And the doctor is very interested of identifying peak level and true level. The next is arterial blood gases. Remember, as we have mentioned earlier, especially the RBC, it is the blood cells where oxygen is attached. And by checking for the blood of the patient, you can actually see if the patient is oxygenated well. You can also see if the patient is receiving enough oxygen by checking for the blood. And this test is called arterial blood gases. Okay, it measures the amount of arterial blood gases such as oxygen and carbon dioxide. Now, if your patient has a problem with the respiration, your patient has a problem with breathing, you expect that the doctor might ask for arterial blood gases test. And normally, the blood is taken from radial, brachial, and femoral artery if the test is arterial blood gases. Now, there are also blood tests performed in the hospital to check for the presence of any enzymes and hormones in our body. Okay. And the test is called blood chemistry. Okay. Now, the second to the last is metabolic screening. I know you are very familiar with metabolic screening. And metabolic screening utilizes blood also in order to check for any congenital metabolic condition. I know you are very familiar with genetic disease, congenital metabolic disease, or metabolic conditions. Usually with the use of blood, doctors can actually diagnose if the person has metabolic or genetic problem. For example, sickle cell disease, thalassemia, these are genetic or metabolic diseases. And through blood, the doctor can actually identify if the problem has metabolic condition. Now, the last blood test is very important because this is what you are going to do next week. Not next week, the following week. Okay, we call this one as capillary blood glucose. From the word itself, glucose, you are testing what? The sugar in the body of the patient. And how can you do this? Simply by taking a small amount of blood from your patient and check if the sugar in the patient's blood is high or low. Now, I want you to look at the photo in front of you right now. See, with the use of small gadget, we call this as glucometer, and with the use of small blood taking from the patient, you can actually identify if the patient has problems with blood glucose level. Are you familiar with diabetes? Can you type in the chat box yes if you are familiar with diabetes? Do you know what is diabetes? Are you familiar with diabetes? Okay, most of the answer is yes. It seems that you are familiar with diabetes. For a patient with diabetes, normally there is a fluctuation of the blood sugar level. Okay? And normally it is greater than the normal level of the blood sugar. Normally, our blood sugar level is within 3.3 to 7.8 millimole. Okay. Once the blood sugar level is below 3.3, that means the blood sugar is very low. We call it as hypoglycemia. However, if the blood sugar level is greater than 7.8, the opposite, we call it as hyperglycemia. That means the blood sugar level is very, very high. And remember, if the blood sugar level is low or high, the patients might develop different symptoms. Okay, now, what are the different capillary blood glucose tests that you are going to perform in the lab? You have fasting blood sugar. From the word itself, fasting, I know you are familiar with fasting. What do you understand with fasting? What do you do if you are fasting? Very good. No eating. You do not eat and you do not drink. Now, there is some test called fasting blood. We don't have this. Yes, don't worry, I'm going to upload this one, the recent slide. Okay, now, fasting blood sugar, you ask your patients not to eat after midnight and not to drink. And then on the following morning, you check for the blood sugar level. Okay? And the normal blood sugar level should be lesser than 5.6. If it is greater than that, the patients might have a problem with the blood glucose. The second one is random blood sugar. What do we mean by random? What do you understood by random? Random means if fasting blood sugar means the patient should not eat after 12 o'clock at night. How about random? What do you understand about random? Random. Patient can eat. Okay, random blood sugar means the blood sugar of the patient is tested any time of the day. I want to take it in the morning, I want to take it in the afternoon, I want to take it in the evening, any time of the day. That is random. And the normal blood sugar should be lesser than 11 millimole. If it is greater than that, that means the patient has a problem. Another test is called postprandial. Postprandial blood sugar or PPBS, 2 hours after meal. That means after 2 hours after your patients eat the breakfast or the lunch or the dinner, you check the blood sugar level of your patients. And normally, the blood sugar level should be lesser than 7.7 millimole. Greater than that, that means the patient has a problem with blood glucose. And the last is called glycosylated hemoglobin. This is accurate test of blood glucose. Why? Because it can determine the blood sugar of the patient for the previous 2 to 3 months. See? It can actually measure blood sugar for the past 2 to 3 months. And the normal blood glycosylated hemoglobin level is lesser than 5.7%. Now, I want you to understand the different types of blood glucose test because in the lab, this is your next procedure in the lab. You're going to measure the blood sugar of your classmates using the gadget that you have on the slide right now. Okay? That's why you need to prepare. You need to identify the different types of test. Okay. I think I don't have time anymore. It's already 3:25. It seems that you have another patient. You have another class. We still have few more slides left, and we're going to have it on the next meeting. And before that, I would like to ask any questions from the class. Are there any clarifications? Do you have any questions regarding our topic? You are free to ask questions now. Okay. Do you have any questions? You can type in now if you have any questions before I dismiss you. Is my discussion clear? Or do you have some doubts? Then you can send it through the chat box, or you can open your audio. Any questions with the discussion? Clear? Sulaiman says it's clear. Aisha says it's clear. Okay, Shaika is saying being an easy calculation, doctor. I cannot assure you that, but if you know the formula, you'll get a full mark. Clear? Clear. Okay. Any other questions related to the course, to the lab, and to the theory? Do you have any questions related to the course, your assignment, your exam, or your any other concerns? Okay, what is that, Diana? Any concerns with regards to your lab, from the lab, or any concerns regarding your theory? Okay? Okay, so that you can do it well, I will stop the recording so that you can actually